Good morning, Senator Ingerson, Representative Meyer, and members of the Health and Human Services Committee. My name is Justin Chenette, and I am the Chief Communications Officer at Sweetser. It's great seeing so many familiar faces I had the honor of serving with. Thank you, Senator Ingerson, for introducing this bill and the many bipartisan co-sponsors, including Representative Meyer, Senator Moore, Representative Daigle, and Representative Gramlich. This committee, the legislature, and DHHS have provided real leadership in acknowledging the plight of families and the lack of in-state care for this vulnerable population. In 2024, when DHHS put out a request for providers to create Maine's first psychiatric residential treatment facility, only one answered the call. Sweetser stepped up to meet the moment, and after being awarded the RFP last year, have been working collaboratively with various stakeholders to make this a reality. This project represents a unifying solution to the pressing needs of Maine's most at-risk youth and reaffirms our shared goal of strengthening Maine families by keeping them together through the healing journey and being fiscally prudent with taxpayer dollars. By simply upgrading an existing building to this standard of care, we are saving the state the expense of building new. And long-term, there will be savings by keeping tax dollars local and without the expensive travel costs. So here's where we're at now. $2 million has been appropriated by the legislature as a down payment to start this program. $2.5 million will come from Sweetser. We are accomplishing this through daily fundraising efforts. We held a gala in the fall. We have a fundraiser Saturday. We have a radiothon next week and a golf tournament in June. When construction costs were increasing, Sweetser once again stepped up to the plate and increased our commitment to the project by $500,000. Sweetser is doing our part. This leaves $3.4 million needed to complete the $7.9 million project. Sweetser has also been actively trying to find cost savings wherever we can. We have been working with our construction partners to review every line item to brainstorm alternatives to bring costs down. Some of that has yielded to savings, but ultimately, there are things we can't compromise on, like safety, security, and creating a true therapeutic setting. Now, don't get hung up on the number in the bill today as we work to exhaust all potential funding options. For your work session, we will either have a clear number or come back not needing this legislation. Since the big game is coming up, I'll use a football analogy. With a few points needed on the board, all we need is a field goal from the department to find a funding mechanism. If we miss that, we need the legislature to score a touchdown to get this bill and get this project across the finish line. If neither one of those two things happen in the next few months, the game is over and this facility will not be created. Maine families from York County to Washington County to Aroostook County will continue to see their youth shift halfway across the country for more expensive care without the natural supports of loved ones close by. So thank you for your time, your leadership, and your consideration.
Senator Ingerson, Representative Meyer, and members of the Health and Human Services Committee, thank you for the opportunity to testify today, and thank you, Senator Ingerson, for sponsoring LD 2065. My name is Jane Van Bramer, President and CEO of Sweetser, and I'm here in strong support of this legislation. I'm here to ask for additional one-time funding and to explain why the projected construction costs for the planned PRTF are higher than the initial estimate and why those increases are necessary to ensure safety, compliance, and quality of care for Maine's most vulnerable youth. In 2024, at the committee's request, Maine's legislators included $2 million in the budget to support the renovation of an existing building to create Maine's first PRTF. That figure was an early internal estimate developed by Sweetser before we engaged an architectural firm or general contractor, before a detailed design and construction cost analysis was completed, and before the state's PRTF RFP was distributed. That figure also did not reflect the funds Sweetser committed to raising through philanthropy. Since that estimate was developed more than 2 years ago, construction costs have risen significantly. The industry has experienced sustained inflation. Tariffs have contributed to sharp increases in the cost of steel, lumber, mechanical systems, and electrical components. At the same time, shortages in skilled labor, particularly those in specialized trade, has driven up labor costs and extended construction timelines. These market conditions alone have substantially increased project costs. In addition, a PRTF is not comparable to a standard residential or commercial renovation. They require highly specialized design features to ensure safety and meet clinical standards. These include ligature-resistant fixtures, reinforced doors and windows, tamper-resistant mechanical and electrical systems, secure yet therapeutic environments, and enhanced HVAC systems to support air quality and infection control. These features are essential for protecting youth and staff and are required to meet standard. The facility must also comply with regulations, including life safety codes, accessibility standards, fire protection requirements, and behavioral health specific licensing criteria. These requirements are non-negotiable and apply regardless of the size of the facility. To operate safely 24 hours a day, the building requires robust mechanical, electrical, and plumbing systems, emergency power generation, security and monitoring system, and fire alarm and suppression systems. Redundancy and backup systems also add cost, but they're critical to uninterrupted care. Site-related conditions have also contributed to increased expenses. Utility upgrades, grading needs, and unforeseen issues such as asbestos are common in this type of renovation project. Timelines have further increased our costs. It's important to note that these investments are not optional or excessive. In closing, our revised construction budget reflects the true cost of delivering a safe, compliant, and clinically appropriate psychiatric residential treatments facility. Supporting this bill and ultimately this construction is essential to ensuring that Maine youth receive high-quality behavioral health care in state they both need and deserve. Thank you for your consideration.
Thank you for being here today. Questions from the committee? Go ahead.
Senator Ingerson, Representative Mayer, and members of the Health and Human Services Committee. My name is Christy Worcester, and I am the Chief Program Officer at Sweetser. I am a licensed clinical social worker and have been working in behavioral health in Maine for 19 years. I'm here today to testify in support of LD 2065 and to underscore the critical importance of one-time funding to support the construction of the PRTF for at-risk youth. The PRTF will be the only facility of its kind in Maine, providing the safety of an inpatient setting within a residential environment, reducing stigma, and supporting a smoother transition back home for children served in this setting. An 8,000 square foot, 16-bed facility, the unit is staffed with a full-time medical director, a clinical director providing 24/7 psychiatric nursing, clinical coverage with crisis staff, CNAs, and behavioral health professionals. Children will spend 6 to 9 months receiving the right level of care at the right time, close to their families and communities. No longer will our children be sent to facilities in Georgia and Arkansas and beyond. No longer will they remain in inpatient units or emergency departments for months while awaiting appropriate care. The PRTF will typically serve children around ages 10 to 18 who require a secure setting for their own safety and the safety of others. These young people may experience suicidal behavior, aggression, attempts to run away, and other highly dangerous behaviors. They may have trauma-related diagnoses, mood or psychotic disorders, or personality disorders. This facility will serve youth and families in every corner of Maine from all 16 counties. Treatment is highly structured and intensive, designed for youth with the most severe psychiatric illnesses. Services will include care for co-occurring substance use disorder, youth with problem sexualized behavior, and children with secondary developmental disabilities. In addition to safety and stabilization, treatment will focus on facilitating a successful transition back home. PRTFs ensure the highest level of quality, safety, and regulatory compliance. The facility will be accredited by the Council on Accreditation, comply with federal conditions of participation under CMS, and be state licensed. Each require rigorous standards and measurable outcomes. As we work to see this project through to completion, cost savings ideas such as reducing the facility from 16 to 18 beds were explored. Ultimately, we found that this would not produce meaningful outcomes. Most expenses are fixed and driven by safety, regulatory, and licensing requirements, like others have mentioned, not by bed count. The same life safety systems, HVAC, security, emergency power, and clinical support spaces are required regardless of the unit size. Downsizing would significantly reduce capacity, increase the cost per bed, and provide only limited savings. Every day that passes is another day without treatment for so many children in Maine, and I urge you to approve the one-time funding for the PRTF so we can begin this vital work as soon as possible.
Thank you. Questions from the committee?
Senator Ingerson, Representative Meyer, and members of the Health and Human Services Committee. My name is John McAnuff, and I am Sweetzer's CFO. I am here today in support of LD 2065 and to express Sweetzer's interest in participating with the state to expand in-state psychiatric residential treatment capacity. As you know, Maine currently lacks psychiatric residential treatment facility, or PRTF capacity, for youth with the most acute behavioral health needs. When appropriate in-state care is unavailable, children often languish in hospital emergency departments or are placed far from home, sometimes out of state. These options are disruptive for families and significantly more expensive for the state. Sweetser has extensive experience operating intensive residential and psychiatric services. That experience has taught us two things. First, there is a clear clinical need for a PRTF in Maine. And second, these facilities are expensive to build, not because they are elaborate, but because they must be safe. Youth served in a PRTF present higher risks related to elopement, self-harm, and harm to others. As a result, the building itself becomes part of the treatment and safety plan. Construction costs are driven by requirements such as ligature and tamper-resistant fixtures throughout the residence, complex access control and egress systems, including secure entry vestibules and remotely controlled exits, continuous monitoring and security systems, including specialized anti-climb fencing for outdoor spaces, reinforced interior construction designed to withstand damage while protecting residents and staff. In addition, these facilities require infrastructure enhancements, including upgraded electrical service with full generator backup, specialized ventilation and cooling systems because operable windows are unsafe, fire protection upgrades, and full ADA accessibility. Many components also require specialized installation methods, which significantly increases labor costs. Sweetser has been intentional about cost containment. This project reuses an existing building on our campus rather than pursuing new construction, which would likely exceed $10 million. We are retaining usable systems, selecting modest finishes, and making design choices that reduce cost whenever safety allows. Even so, the clinical and regulatory requirements of a PRTF create unavoidable capital expense. LD 2065 is important because it recognizes that these kinds of costs are a major barrier to expanding PRTF capacity. Without state partnership, nonprofit providers cannot assume this level of financial risk, and these facilities will not be built. Sweetser is interested in working collaboratively with the state to develop a PRTF that keeps children closer to home, reduces reliance on emergency departments and out-of-state placements, and fits within Maine's broader continuum of care. We view this as a partnership that must balance clinical quality, safety, and long-term sustainability. LD 2065 is a thoughtful, targeted investment in Maine's children and in Maine-based solutions. I respectfully urge the committee to support this bill. Thank you for your time, and I would be happy to answer any questions.
Thank you. Thank you for being here.